Welcome to South First Debate. I am Chetana Belagere. After visuals from Beijing on hospitals flooded with COVID-19 patients and crematoriums filled with bodies, there's an alarm being raised globally on the way China is managing the COVID-19 situation and its repercussions globally, including India. To discuss this, we have with us renowned epidemiologist and member of Technical Advisory Committee for COVID-19 in Karnataka, Dr. Giridhara Babu, Dr. Rajeev Jayadevan, Co-Chairman, National IMA COVID Task Force from Kerala, and Dr. Rakesh Mishra, noted scientist, Director of Tata Institute of Genetics and Society, who's working on wastewater surveillance for SARS-CoV-2 and other infectious diseases with the government of Karnataka and many other state governments too. We welcome you all.
Thank you. Thank you.
Thank you.
Dr. Giridhara Babu, I'll come straight away to you. What does China's situation mean to India? Is this a cause of concern?
Yeah, so definitely it is a cause of concern for the Chinese citizens and people within mainland China, because after the first wave, they have not witnessed any other waves as such in terms of infection. Therefore, they do not have natural infection spread through the population. At the same time, the indigenous vaccines within China have not been that effective. The data is not really forthcoming, as a result of which vast majority of Chinese population are at the risk of getting the infection and its complications in this way. So whatever was Delta to us or all the other waves to us, it is the Omicron and its subvariant for China. Now, we all know by now that the moment virus starts circulating widely at a very fast rate, it also has more opportunities to change itself. So therefore, we need to be tracking what kind of changes that are occurring within China, and will that have implications for spreading in other countries, including India. But what we already know is booster coverage, even with the study from the CMC law, using either Cobivax or Covishield, irrespective of what the primary doses have been, will offer advantage against death and hospitalization, which means we have now time to expand our booster coverage. For various reasons, it has not been up to the mark. That will give us an additional layer of protection in addition to the hybrid immunity that we are speaking of. A vast majority of the Indian population having both natural infection and 2 doses of vaccine at least. So that's the area in which we should be strengthening, along with improving surveillance. As you know, there has been some lacuna in terms of treating COVID as no longer a illness of importance, if not PHIEC. So therefore, testing levels have gone down, and therefore we need to step up surveillance wherever possible, especially in the missed areas. And genomic sequencing concurrently along with the outbreak investigation is the key, because the faster we detect any changes, the faster can we respond to that.
Okay, so you are saying that it is right now not an alarming situation here in India, considering that we have a hybrid immunity. Dr. Rajeev, do you agree with this? And also, you have been tweeting quite a bit on China's strategies and its zero COVID policy. So, do you agree that India is better positioned when compared to China? If yes, how do you think we are? Is it the vaccines which have worked, like Dr. Babu said? So, what is your stance on China's way of handling it and India's position
now? To answer your question, we must remember the timeline of COVID. Many people have lost their lives all around the world, and we must not forget that. So the question can be answered either as of today, or if you look at over the past 3 years. If I answer the question, is India a better place today? Yes. As of today, yes, India is better placed because of what Dr. Babu mentioned. We have plenty of hybrid immunity. That's a term that's been used for a combination of natural infection, survivors of natural infection, to be precise, and vaccination. So India is better placed, but we must also remember the number of lives India and other nations have lost in the process of getting here. So that is something that we must never forget. Even one life lost is a life lost, and there's no replacement for that. So if I take a timeline, if I answer the question in a different format, let's say in the last 3 years, is India a better place? India is not better placed. or the rest of the countries, because everyone has lost a huge number of lives. From that perspective, in the last 3 years, the number of deaths officially reported by China are several hundred folds lower than that of, say, United States. These numbers are adjusted for the population. So we can't put a number on that. We can't estimate. We can't say what is good or bad based on this, but I'm just giving you the numbers. But the flip side of that coin is where China is at now, that a substantial number of their vulnerable population, that's people over the age of 60, specifically people over the age of 80, only about 2/3 of them have been vaccinated. So 1/3 of people over the age of 80, that is 10 million people, 1 crore individuals in that country remain unvaccinated as of last month. So that might have changed, I do not know. But that is a scary situation to be in. If you ask me, I'd be very concerned if any country was in that position to have 10 million people sitting around who are the most vulnerable for death and other horrific outcomes when a fast-spreading virus with immune evasive properties built in is spreading in their region. So that is my concern at this time. Over the age of 60 also, the vaccination coverage is not very much. And if you put all the numbers together, about 2.5 crore people over the age of 60 are or under vaccinated in China. That's a large number of people.
Okay. Yeah, I agree with you. And, when we are talking about vaccinations, we're talking about variants. And obviously, as we've already learned that, in the last 3 years, we've seen whenever there has been, the mutations keep happening and the new variants keep coming. So Indian government has asked, as we speak now, there's a meeting happening with the Union Health Ministry where there is a review meeting of COVID-19, the situation, and also the ministry has written to Indian states asking them to increase genome surveillance and other kind of surveillance. So, Dr. Mishra, if you could throw us some light about, how is our surveillance system? People are not testing. I mean, there is lack of people taking booster doses, plus now they're not testing. So what are some of the options in front of us now, considering this scenario?
So, see, there is no alternative to keeping your eyes open when you are walking. So surveillance is like that. You know what is around, so what to avoid and whether we go slow or fast. So surveillance is not a treatment, but it lets us know what is happening so we can strategize things. Other thing is to taking precautions so that spread of things, if it happens, is slower so that hospitals not flooded so we can save lives. So these are the very basic fundamental strategy. That is where Chinese have failed. They adopted zero COVID policy and they got time, but they did not vaccinate properly. So now they are really vulnerable to what we were almost a year back and so on. And so there will be flooding of infections and so on. And as you just heard that large number of people there are unvaccinated. So I think what we need to do is there is no need to panic. We have sufficiently strong immunity by now of vaccine and natural infections or hybrid immunity and so on. So what we have to do is increase the testing, so individual testing so that we can sequence clinical samples. We are already doing wastewater surveillance and sequencing of the genome. So we have general idea of what kind of variants are happening in at least in Bangalore and a couple of other cities. And there's nothing really to worry about at the moment, but these things can change. But we need to sequence more individual samples, which has slowed down because we thought that we are done with the COVID. And as Dr. Babu mentioned, that booster dose should be accelerated so that it makes us even better, those who have not taken their booster dose. If we do all those things, see, the reason to worry about is, as you actually just heard also, that when there is lots of people are being infected in any part of the world, the virus is getting more and more chance to experiment with its various avatars. And if something of them becomes more infectious, and unfortunately it become also more clinically troublesome, that creates the problem. So we have now given a big chance for the virus to play with us. So, and the only way we can minimize our damage is to keep very, very watchful. So, test and keep following what kind of variants are coming. Most people will not even require hospitalization who will get infected there, but we will know which variant is coming. And the symptoms are, we can correlate with the change in genome sequences. Once we know that, then we have learned how to deal with. Our clinicians are now much better equipped in terms of ideas on how to handle such patients. And basic thing is we need to know if there is any new variant emerging and from where, and take precaution that we stop or slow down the spread from there. So there is really nothing very new or novel. We just have to tighten our belt, and maybe winter is going to be a tough one. So we have to just see that we pass that without much of a disaster. So, that's all it's required. As our mentioned here, let's boost increase the booster dose, and keep following the genome sequence, which we have infrastructure now already. Everything is in place. We have to just keep doing those, and I'm sure today government discussion this will emerge, and government states will be given more advices, instructions to carry on this thing in a active manner.
Okay. Dr. Babu, if we're like Dr. Mishra pointed out, the booster doses is very important, but we have seen that a lot of number of people are complaining of, there are different associated, which is still yet to be established, but then there have been cardiac deaths, and there is a lot of fear with taking booster doses. So do you think in this scenario, when it is important to get boosted, take a booster vaccination, but then people are not coming forward. So do you think now is the situation when they have to? And are our vaccines, like when you're talking about Chinese vaccines, we're talking about how they have not been really, not protected them enough. But are our vaccines better? The Indian vaccines which we've been taking, are they better? What do you have to say on that? I think all three of you, if you can just quickly tell me on your view on this.
Yeah.
Dr. Babu, you can.
So to begin with, we should be looking at evidence in terms of which vaccine works and what kind of booster policy has been there all over the world. So among the vaccines that we have, the study from CMC Vellore clearly documents that even when the primary vaccine for the 2 doses, whether it is Covaxin or Covishield, using Cobivax will give better immune response. Similarly, using Covishield in the absence of Cobivax is also useful in terms of boosting up. Now, this evidence is coming from within India, from very well established and very well done research. So I think we should be taking this as the base for expanding the booster coverage. Now, why it is low, we all know. It's a mixture of demand and also in terms of how easily it is available. During second wave, the fear of death and hospitalization also acted as a factor in increasing the vaccination coverage. It's unfortunate. We don't need such kind of negative motivational tools to improve the vaccination coverage. So this is the time for both the community and the governments to work together and expand the booster coverage. That's what I would say about the boosting the population, especially the vulnerable and the people with comorbidities.
Dr. Rajeev, if you can quickly tell me about who do you think should be taking this boosters, and is it really important now? What do you have to say?
Yeah, the people who should be taking the boosters more proactively would be the vulnerable individuals, and that does not necessarily mean elderly people. It also includes adults who are having medical conditions that put them at greater risk. And there's a long list of medical conditions. I'm not going to go through that, which put people at greater risk. And I chair the Tuesday meetings ever since the start of the pandemic, and we regularly look at clinical data here. I can tell you that there are, even though these numbers are very rare, there are people who have not taken the vaccine. And we do see occasional bad outcomes, fatal outcomes when they get COVID. So don't underestimate Omicron. And sometimes natural immunity might not be enough to cover you, because it's hard to believe that there are still many uninfected people in our country, because we're a thickly populated country. There's a lot of social interactions. Many of us would have been infected even without our knowledge, but that alone appears not to be protecting everyone. So if you're clinically vulnerable and you're an adult, I think you ought to go and get your booster.
Dr. Mishra, any thoughts on this?
I just agree with our both colleagues that booster dose wherever applicable, it should be given. Now we have lots of vaccine. There is no started problem. There are new vaccines. There are even RNA vaccine of Genova and the nasal vaccines, and B has made. So we have many options, and heterologous vaccines. I think some of them have been even being tested as a booster, how effective they are. And we should keep in mind that although there are some discussion that side effects of vaccine, but the side effects of the COVID infection are far more than vaccine. They're pretty safe, and I think we should not get confused and wait for virus to trouble us. So whoever has not taken booster should be encouraged, and if we do rest of the surveillance, and I would just want to repeat and say that when you are going new places, where the mask is much more handy and best way of defeating the virus. Otherwise, virus will take over, and we'll go again in various trouble. So we keep doing everything normal, wear the mask, and if we are boosted, then we are fine.
Okay. Dr. Babu, just to conclude, if you could just summarize, now that this is winter, and then we also have holiday season coming up. So keeping this on mind, what are the quick 5 things which we should be doing?
Yeah, I think more than the quick aspects, this is the time for us to remind ourselves that after a defeat, responding really well might be a okay thing in some of the sports that we love to watch, but not when it comes to managing outbreaks. We have already seen how the Delta wave has been, and in our lifetime, there will be more and more zoonotic disease outbreaks that we'll see affecting human beings. So surveillance has to be strengthened all over, for not just for COVID-19, but also for all the other infectious diseases. There are various platforms, including IDSP, NVBTCP. All these will have to be sort of integrated from the user and at the endpoint. Strengthening surveillance will give us enough confidence that we have the burden of diseases and we need to tackle them. That's when we can prioritize acting on them. So if I have to put all my bets on something, I would say put all of it on surveillance and strengthening our vaccination program, because we can't be tackling each virus by itself and exhaust all the resources. We have already seen how the health system has got affected in catering to maternal and child health services, NCDs, tuberculosis. So once we strengthen the surveillance and strengthen the vaccination program, we can then take care of overall health of the community.
Thank you very much. Thank you all for your time. It was wonderful discussing the situation, and also to understand that it is not really alarming as far as we continue to wear our masks, avoid the crowds, and probably, like you said, the booster doses and the surveillance. Thank you very much for all your time. Thanks a lot. That is all we have for now. Thank you.
Bye-bye. Thank you all.
Right.